So it's interesting. Our next story here concerns AI. And typically when we talk AI, we're not necessarily talking medicine, but in this case, we are. Darran Fischer is managing director at Philips Canada. There's a new report out now that basically, this is the statistic that kind of stands out, and then we can go from here. A recent report, this is their report, shows 71% of Canadian patients have waited to see a specialist, and the average wait time for that appointment, 131 days, so more than 4 months. Now, I'm telling you this as Canadian. You know the situation in Quebec is in all likelihood worse, certainly when it comes to seeing medical specialists. But regardless, it puts Canada in the rather unenviable position of having the longest wait times to see a specialist in the world. Hard to believe? That's what this study, however, shows. Darran Fischer is a managing director there. He's on the line. Mr. Fischer, thanks for your time this afternoon.
Hey, good afternoon, Aaron. Thanks for having me.
Let me begin with that. I mean, I know, we've heard this and people have experienced it obviously as well. Nothing is perfect. The healthcare system could be a lot better. We are last in the world when it comes to seeing a medical specialist in this country?
Yeah, there's certainly some interesting data in the report. And maybe if I just back up, Philips has been publishing the Future Health Index for the last 10 years. And this is the first year that we've solicited feedback and surveys from the Canadian population. So 100 healthcare practitioners, 1,000 patients, and absolutely there's some really interesting data that pulls through in the report. And it's titled Building Trust in Healthcare AI because we see this as a huge pivot point, an opportunity to really transform the healthcare system and actually bring some of those wait times down.
So, well, let's talk about that because that's the crux of the issue here is AI. How do we involve AI in that? And I think to our situation in Quebec, by the way, it became an issue here because we're still using, at least we had been up until I think the beginning of this year. I'm not sure if it's changed now. Fax machines are still part of our healthcare system here. So adopting AI seems like, something light years ahead. How prevalent is this in other systems across the country or how likely is it to happen and become standard?
Yeah, Aaron, it's relatively new. And I think that a couple facts to consider, right? Healthcare practitioners believe in AI, right? They see the future of AI and they see the opportunity for efficiencies, right? Specifically in standard tasks, right? Automation around scheduling, follow-ups, et cetera, and implementing that because they believe that will allow them to move quicker and also reduce wait lists. From a patient perspective, what we found in the report is there's a little bit less optimism from patients around using AI in the system. And we actually see healthcare practitioners at about 86% optimism, and then 49% for patients, right, creating an obvious gap. And so where patients see the opportunity is in sort of that administrative side of things, but there's a lack of trust as it comes to pointing and directing clinicians, doctors, nurses to data, to images, to augment care. That trust is one that we obviously need to close here in the healthcare system.
How do you begin doing that?
Well, it starts first by committing to AI, right? So committing to AI on specific standard tasks, et cetera, and sort of building that up. And then also from a clinician perspective, what we found is when clinicians take the time to explain the use of AI to their patients and explain thoroughly sort of how they're using it to augment diagnosis and evaluation of their health, the trust level goes up significantly.
Are you seeing other jurisdictions doing a better job of this than we are? And I realize we're not doing very much of it right now, but in terms of other jurisdictions where this has become part of their system and it's working?
Well, we see it in pockets, right, Aaron? So even in Canada, there are pockets where scheduling follow-up appointments are using forms of AI tools. But what we're not seeing is sort of those connections right through the care pathway specifically. So we see both in Canada and other jurisdictions, we see AI adoption, but it's quite fragmented this far. And so the Future Health Index is really a call for an opportunity for us all as Canadians to look at the data, see what patients are saying and healthcare practitioners are saying, and make a concerted effort to move in that direction because it's going to help our healthcare system.
Is part of the rationale here, the reason it's not being adopted as quickly is because the technology is not necessarily all the way there, or is cost a factor here?
It's a good question. like anything, there's a change curve, right? And so changing the way that we've done things historically for years and years and years in the healthcare system, it takes time, it takes courage, to get there. And what we find is those first movers are seeing the benefits of AI. And we're seeing movement within the healthcare system and with wait lists in certain pockets. But again, that end-to-end view of looking at the healthcare system, it's still very fragmented here around AI adoption.
Usually when we look at things like this, where you have a change to a system and adopting something new, in this case, AI would be it, I would ask, well, I'm asking about other jurisdictions, but in terms of the technology being adopted, sort of with open arms, if we're dead last right now, the figure I cited at the beginning of the interview, right, in terms of waits for a medical specialist, and you look around the rest of the world, the countries that are at the top of that list and not at the bottom, what are they doing that we're not?
Yeah, it's a multifaceted challenge, right? What we are seeing in other countries, we are seeing quicker uptake of new innovations, right? That might be on the imaging side or might be on the lab side. That do accelerate diagnosis, tests, outcomes for patients. That's certainly one of the pieces. But if I pivot back to some of the the data that we found around patients' optimism and comfort level and confidence, one of the pieces that was called out specifically in the report is if patients can reduce the wait list through AI, then they're willing to do so. Right? There's a little apprehension, but if they can see real movement in the system, they're willing to sort of move quickly through that change curve around AI adoption.
Which seems almost, that's pretty logical, right? Anybody would want to save the time, and if you can use AI to help you save that time, of course they would. I don't know. I guess my last question, I don't want to repeat myself, but when you look at our healthcare system here, and there have been, people looking at this and saying it's been deteriorating over the years, does government have to play a role in here?
Oh, absolutely. I think from an industry perspective, if we look, from our company's perspective, Philips, you think from a government perspective, and you think from a healthcare delivery across, hospitals, home care, long-term care, everybody has to play a hand in this. And because it's an orchestrated effort from acute care, right, in the hospital and back into the community. And so everybody has to play a hand in that. And some of that requires, funding, right, different ways of looking at care delivery from a government perspective, and then adopting new technologies and moving quickly here in that.
And are you, do you think that that's in fact what's happening? Are you talking to the federal government, I'm sure? You getting a sense that the government is ready and open to do something like this?
I think governments are absolutely open to conversations around opportunities for AI, as an example, or other care delivery pathways. Again, we're so entrenched in the way that we do things. It takes some first movers. It takes some courageous efforts of leaders in hospitals to make those moves. Mm-hmm. But we are seeing some movement. But we'll continue to advocate for change and continue to bring our innovations to the market so that clinicians can use them.
Well, I wish you luck. And, at the end of the day, if it, makes wait times and reduces them, then obviously it's a good thing for everyone. So let's hope it begins to happen. Thanks so much for your time. Appreciate it.
Thank you, Aaron. Take care.
All right. AI in medicine. It seems like a no-brainer, doesn't it? In a sense, if it can make things better, why are we hesitating? Is it about cost only?
I'm Dylan Playfair.
And I'm Tyler Smith.
We're putting loneliness in the penalty box by talking to some of our favorite athletes about the importance of friendship.
This is Bromance.
Bromance is brought to you by Charm Diamond Centers, proudly Canadian-owned and operated. Charm has been part of your love stories and bromances for over 50 years. And you can find Bromance on the iHeartRadio network or wherever you get your podcasts.